I think we can start, Dr. Ayyappan, Dr. Balaji, if you are ready.
Yes.
Or do you want us to wait for some more time? Anyway, people keep joining. So if you think we can start with the session, I think we can do the introduction. Yeah, good evening, everyone. Once again, I am Saraswati, Secretary General of the Chamber, and very happy to have this yet another virtual session under the Healthcare Committee of the Madras Chamber of Commerce. I checked, we started it in 2024 June, Dr. Ayyappan, if you recall, and this is the 8th in the series. Maybe we can increase the frequency as we go along. Maybe monthly, at least one session. I'm sure from now on that should be the thing. So thanks once again for to everyone who have joined the session now. People are still joining. In the meantime, let me request Dr. Ayyappan to say a few words, introduce Dr. Balaji, and then we can go ahead.
Yes, ma'am. Thank you, ma'am. Good evening, everyone. It gives me great pleasure to welcome you all to this important webinar, Organ Donation, Gift of Life, organized by the Madras Chamber of Commerce. Today, we gather not only to share knowledge, but also to inspire a movement that has the power to save countless lives. Organ donation is truly one of the most selfless acts of humanity, a legacy of hope, love, and life that continues even beyond our own. We are privileged to have with us our keynote speaker, Dr. Balaji Krishnan, a highly accomplished nephrologist practicing at the main Kaveri Hospital in Chennai. With extensive expertise in nephrology, dialysis, kidney transplantation, and renal disorder management, he brings a wealth of knowledge and experience to this forum. He got his MBBS from Ramaya Medical College, MD in General Medicine from JSS Medical College, and DNB in Nephrology from Apollo Hospitals in Chennai. With a strong blend of clinical practice, research, and academics, Dr. Balaji has performed numerous kidney intervention procedures, actively participated in transplant programs, and presented papers at leading national and international conferences. His research on malnutrition, inflammation, and dialysis outcomes has been widely published in reputed journals. An active speaker at forums such as Deloitte, the Indian Medical Association, and various educational institutions, he has raised awareness on women's health, diabetes, hypertension, and organ donation. Recognized with several awards, including the prestigious Gold Medal for General Medicine, he combines clinical expertise with a passion for teaching, research, and community health initiatives. Given his experience and dedication, Dr. Balaji Krishnan is an apt choice to lead today's session on organ donation, inspiring communities to better understand its importance and impact. On behalf of the organizing team of Madras Chamber of Commerce, I extend a very warm welcome to Dr. Balaji and to all of you present here today. Let us make this session meaningful, spread awareness, and encourage more people to embrace organ donation, which is truly the greatest gift of life. Over to you, Dr. Balaji.
Thank you, sir, for the wonderful introduction. Thank you, Saraswati ma'am, for having this session. And we hope we'll all will learn better from this session. So I have prepared a small PPT for all of us to understand. Basically, what is organ donation? I'm sure most of them will be having doubts on how to donate, whether I can donate, whether a relative can donate. There'll be so many questions in all of our mind, and then we will clarify all this in the next half an hour or 45 minutes to come. So we all know that we wanted to have this seminar actually in the month of August. August 13th is the Indian World, August 13th is the World Organ Donation Day. India also celebrates it on 2 times, that is August 2nd and August 13th. So we'll get to know what all organs can be donated and what is this donor card. It says, I am an organ donor. So it says, what is this NOTO? All that we will go through in the next few slides. I wanted to start with this slide. And so this is, of course, all of us know this is Lord Ganesha, and we call him the god of transplant surgery. And in fact, it's quite obvious. And so he's doing very well. And he's the first person whom we do all the pujas, and he's the Vignaharta. So he himself is the father of transplant, or the god of transplant surgery, however you call it. So just a brief overview or the oversight of what I'll be discussing in the next few minutes. Basically, I'll be introducing the terms. I'll be giving few definitions. I'll be explaining to you about the types of organ donation. What are the types of death? List of organs that can be donated. What is the difference between India and the outside world? And of course, we have to discuss something about medico-legal cases, about the law in the country which enforces our transplant program. And suppose if anybody wants to become a donor, how do I become a donor? And then I have few slides on myths and facts. So to make the presentation more interesting. So first of all, there are two things. There's something called tissue donation. There's something called organ donation. So the organ donation means the organ is donated. We all have different organs in the body. I'm sure all of you must be knowing we have heart, lungs, liver, kidneys, pancreas, intestine. So on the left side of the slide, these are the list of organs which can be donated. On the right side, we have the tissues also which can be donated. Cornea, the valves, the veins of the patients, the skin, bones, and the tendons. So this is essentially the difference between organ and a tissue donation. So the organ donation, suppose if you're taking a liver or if you're taking a kidney from somebody, it can be from a live person, or you can take the organ from a person who is dead. So organ donation can be both living as well as you can obtain it from a dead person. So as till now, we will understand this much. I'll explain further in the next slides. Tissue donation. Suppose if you want to obtain few tissues as I listed, veins, heart valves, the cornea, all this is only it's only from the deceased donors or the dead donors. So what is the definition? Organ donation, process of surgically removing an organ or a tissue from one person. That person is called the organ donor, and you place it into the other patient or the recipient. So these are the terms which are important. So who is a donor? As you all know, the person who gives the organ is the donor. The person who receives the organ is called the recipient. We call them patient in our medical language. We'll be talking about the patient, but when it comes to transplant, that patient becomes the recipient because he receives the organ from the donor. And transplant is, of course, the surgery or the procedure that is carried out. So what are the types of organ donation? As I briefly hinted in the previous slides, we have two types of organ donation. One is living donation. A person donates his or her organ, and after the surgical procedure, he stays normal after donation. In India, 80 to 90%, as of now, up to date, even 80 to 90% of all the transplants are from living donors. We have an emotionally connected country. The family bonding is extreme and immense, that if we hear somebody in the family who really has a problem, a kidney problem or a liver problem, families still do come to donate the organs. But because of our population size, the number becomes very sparse. And I'll be explaining to you in the other slides. The second type of donation is called the deceased donation. After brain death, usually the organs which are harvested and given to the patients are called deceased donation. In India, 10 to 15% of all the transplants are deceased donors. So why do we need to talk about organ donation? Why should we talk about organ donation? What is the need? And so that comes from the burden of the chronic conditions. See, when you look at the graph here shows the patients who are on the waiting list listed by organ. So this is the data from the US, which is supposed to be a developed country in advance. They have a lot of protocols. Their legal system is through, and the organ donation is considered the norm. There also you see that the waiting list as of the year September 2024 for kidney is somewhere 80,000. Liver, there are still so many, and all other organs are still a huge number. This is because there is a supply-demand mismatch. So what is the supply? Supply is the number of organs what doctors and hospitals get. That is the supply. Demand. What is the demand in this situation? Basically, it means that the number of people who have chronic diseases, that is, it can be a chronic kidney disease, it can be a chronic liver disease, it can be a refractory heart failure, it can be blood cancer patients waiting for bone marrow transplant. So basically, the organ, the supply-demand mismatch is very much even in the developed state, and hence we always need to encourage the organ donation. If you see the data or the statistics from the India, the number of people on kidney transplant wait list as obtained from the center Noto is 57,806 people. So in kidney transplants in 2023, yes, it was very less. You can see a significant jump has been happening. We are improving, but the improvement is not enough. Always the demand-supply mismatch is always there. Hence, there is an urgent need to encourage organ donation in India. This has to be done at multiple levels. It cannot be done by the center alone. It has to come to the grassroots levels. It has to go to the villages, the rural areas. In fact, college and school children need to be educated and awareness. And last but not the least, we should also hit against the cultural barriers which exist in donation. So most of the families feel that, giving an organ is against their cultural belief and they will not be able to perform the last rites. And so many myths are there for every family. And it requires a lot of counseling and a lot of patient time and effort to get a success or improve our overall organ donation in India. So one donor can save up to 8 lives through organ donation. So they can donate, as we see in the figure, the small intestine. They can donate 2 lungs. I mean, generally they give 1 lung or 2 lung depending on the condition of the patient. Similarly, 1 kidney or 2 kidneys, liver, pancreas. So one donor can save up to 8 lives. Similarly, where all do we use the tissues? As I told, we also harvest the tissues from all these patients. The most commonly used is the eyes and the corneas. They use it for the restoration of the sight. We have the heart valves, the skin which is used. We have the veins which is used for bypass, nerves which can be used, the long bones, people who are, who are amputees following road traffic accidents or bone cancers. And you have a number of uses for these tissues. And so even tissue donation is also equally encouraged as organ donation. Now, let us look at the remote differences. Let us look at the differences between India and compared to the other countries. The donation rate, the organ donation rate in India is very, very low. There is no problem if somebody from the family itself comes for organ donation. The whole problem is solved. They are very lucky. When they have nobody in the family to donate, they have to rely on the deceased donor or the waiting list from the government. So that is the problem. So the donation rate is where there is a low deceased donor donation. So family members give related transplant, as I just now said. We do have high prevalence of unrelated transplant that's happening under the cover, which the government is taking strict regulations and is not at all being encouraged. If you look at the donation rate abroad in Europe, Australia, and US, there is a compulsory opt-in donation after the death. Somebody who dies in the hospital, they are taken for organ donation unless proved otherwise. If they don't want their organs to be donated, they have to go request the ICU and the hospital team to say, no, we don't want organ donation. They are allowed to do that. But if anybody is admitted to the ICU and if they die, automatically there is a system which goes inside that they can donate the organs. The whole continent gets flashed, and the consent is taken at the time of admission itself. So that is the kind of process what the other countries have adopted. So, and that is the fundamental difference between India and the US. So the public attitude towards organ donation in India, as I said, it's clouded by religious myth, mistrust, and fear. And in abroad, it is still considered an act of noble deed. And awareness is very poor. As I mentioned, we should get to the grassroots level in the villages, schools, and the suburban areas. And in abroad, if you see, organ donation and transplant is a basic education from the primary itself. So all this makes a difference in a whole. In India, we do have laws. The laws are very strict. In fact, Human Organ Transplant Act, it's called HOTA. It has undergone regular amendments. They have done few. They have given few gaps for transplant to be done when they have grandparents or near relatives to come. All that is also allowed in our country. In our country, there is brain death, which is defined, but there is weak enforcement and there is variable hospital complaint. So that is the problem. Not all hospitals across the country follow the HOTA. That becomes a serious issue. And the hospital compliance for organ donation, and that is also very, very less. In abroad, there is a strong legal clarity, mandatory brain death declaration, and there's a strict vigilance governed by the OPTN network, which is there. The infrastructure in India is limited ICU, trauma centers. They do not declare brain death. I'll come to what is brain death for all of you to understand a little better. We need a separate team, a clinical practicing doctor like a nephrologist or a hepatologist or a surgeon. They cannot go on seeing brain dead patients in ICU, and they cannot counsel the family. It requires time. It requires at least 24 to 48 hours of continuous counseling, sitting down with the patient's family, explaining them the benefits, explaining them the risks, if any. So we need more coordinators, ICU team, organ retrieval team, they are called. So all this needs to be established across all the states equally, which is still less in India. And of course, in abroad, all this is very, very streamlined. So the whole talk about the transplant comes as to how to improve this deceased donor. Deceased means death. How do we improve the deceased donor organ transplant in India? Who coordinates this in India? So it is the Apex Institute is called the NOTO, National Organ Tissue Transplant Organization. So they have divided into 5 ROTOs, that is Regional Organ Tissue Transplant. And under the ROTO, we have state, which is State Organ Tissue Transplant Organization. So this is the year-long national campaign, Angdan Jeevan Sanjeevani Abhiyan, which has been done at the national level. It seeks to promote organ and tissue donation across the country. Our country has a robust organ donation drive program. Even our state, I should mention that Tamil Nadu is the #1 in the organ donation program rates across the country, and they have been maintaining it consistently for the last, I think, more than 7 to 8 years. So both at the state and the national level, things have been going on great, but we still need more people to come forward for deceased organ donation, removing all the cultural beliefs. So this is the NOTO, and this is the stepwise coordination. So where the national level, they are responsible for the governing the laws, the allocation of organs across all the ROTOs, the ROTOs which are 5 in number. For North, it is Chandigarh. South, the headquarters is Chennai. For West, it's Mumbai. East is Kolkata, and they do have a center in the Northeast, which is Guwahati. Again, you have state-wise, you have SOTO. And the last level is the individual hospital level, where they identify all potential donors. They maintain the patients who want the wait list of the transplant, who are registered in that particular hospital. All that is maintained by that particular hospital and the institute. It can be a government hospital or a private hospital. So moving on to a little more of the epidemiology and statistics. These are the data from 22 to 24, and this is collected from the Government of Ministry of Health and Family Welfare from the NOTO website. So we see that there is a consistent exponential growth in the organ transplant. So the number of transplant done for kidney 22 was 11,000, whereas in 24 it's 13,000. And if you see the liver also, it's increasing. Small bowel, kidney, multi-visceral organ transplant is also on the rise in our country. So the positive trends is that India achieved a record of total of 18,911 transplants in 24. Kidney transplants dominate 71.3% of all. Liver also shows consistent growth. The deceased donor transplants, that is the organs which are obtained from the brain dead patients, they have increased by 15.9% in 2024. Lung also is following behind. Of course, the areas for improvement. If you see this is what we all need to look and concentrate. The organ donation rate remains under 1% nationally. So basically, we calculate the number of people who donate per parts per million population. That is still less than 1%, unfortunately. There are 63,000 people still waiting kidney transplants. And they've registered from the year 2016 and 17. They're still on dialysis. So there are 22,000 people waiting for liver transplant. There is an urgent need for increased deceased donor participation. And there's a lot of regional disparity across the axis. So, this is the data in 2024. India has performed 1,128 total deceased donors for kidney. We have 5 high-performing states: Tamil Nadu, Telangana, Maharashtra, and we have Gujarat and Kerala. So these are the 5 states who are predominantly do in the transplant. So that's what I said. There is regional disparity. Few states have concentrated on this disease organ donation. It's not like the other states do not have the bodies, but they need more proper infrastructure and more hospitals and doctors to support them. As I said, our organ donation rate is very low, 0.52 donors per million population. So this is again the split of all the state-wise which has been done. I'm not going into the details, and every state is still increasing. And as I said, the overall national rate is still below one donor per million population. So if you see, most populous state in India is Uttar Pradesh, correct? So, but the donation, organ donation rate is very, very minimal despite the large populations, what is seen. We have excellent institutes for transplant like IKDRC in Gujarat. So, but still their organ donation rate, the number of transplants, what they do from deceased donor is less as compared to Tamil Nadu, because again, the cultural belief in organ donation in Gujarat is less, though every state is doing their best to overcome all these hurdles. So next, I'll just move on to the different types of death. So do not get too petrified. I mean, do not get too worried about knowing about the type of death. So I think this is all essential. This is all like a basic knowledge for the public. We all should know what is brain death, what is cardiac death. So brain death is the term which is used there is permanent and irreversible cessation of all brain function, including the brain stem. The brain stem is the hind portion of the brain. The brain at the back side of the brain governs the vital organs, that is heart, breathing, circulation, blood pressure, everything is master regulator is the brain stem. So when the brain death happens, the brain stem stops functioning. And in India, brain death is legal. If you want to legally certify somebody as dead, if he is brain dead, he's dead. So brain dead is equal to being dead even though your heart is beating. So this is the legal definition of death. Eventually, brain death may lead to cardiac death depending on the time frame or the clinical condition of the patient. So what are the commonest causes of brain death? This is very important. See, we have to know that the most important common cause of brain death in our country is still the traumatic brain injury following a road traffic accidents. It can be because of trauma, intracerebral hemorrhage. This can happen because of a stroke in an elderly patient, and it can be because of a brain tumor. These are the commonest causes what we need to know about the brain death. Now, somebody who's brain death in the ICU, how do doctors find it? I'm not going into the details. I just want to tell that brain death patients will be there in the ICU. They'll be in a comatose condition. They have to satisfy a whole list of neurological examination, and they have to undergo something called apnea test. It should be certified by a registered medical practitioner, not involved in the management of that case. Suppose if I have admitted a patient like this in the ICU, I cannot go and say he's brain dead. I need another person, either a neurologist or a neurosurgeon or an ICU consultant or an anesthetist to certify the brain death for these kind of individuals. So again, there'll be few confusing terms. Coma is unconscious state, but the brain stem function is still intact. Brain death is when there is coma plus the brain stem function goes for a toss. So what is cardiac death? You would have all heard about cardiac arrest. No, he suffered a cardiac arrest. There is a sudden cardiac death. So what is this? So cardiac death is irreversible loss of the heart function. So this also leads to death. Ultimately, the blood supply of the brain is from the heart only. So if there is a cardiac arrest or a cardiac death, eventually it will lead on to a brain death also. So both are interconnected, but they have been medico-legally transplants, they too have been divided. So cardiac death can be because of a heart attack. They say, no, there's a heart block. You do a coronary angiogram. There's a triple vessel disease. There is a bypass. They'll say a patient has to undergo bypass. That is heart block. It can be because of abnormal beating of the heart. Heart normally beats lumped up, but it can beat suddenly. It can start beating at a rate of 240 beats per minute. So cardiac death can occur because of any bad infection. It can be because of poisoning. There's a huge lot of conditions leading on to cardiac death. So in general, this is the difference between brain death and cardiac death. So in India, the last thing is very important. In India, 80 to 85% of all happens after brain death. It is the timing of the brain death is planned and controlled. You cannot predict when a heart will stop beating. You cannot say when a person will have a heart attack, right? But any patient who gets admitted to the ICU with bleeding, after a road traffic accident, after a major surgery for a tumor, all this can be predicted. So it is a planned and controlled timing. You can preserve the organs. All the organs can be harvested after brain death, and it has to be, and it gives us some time. But cardiac death, if at all you want to harvest the organs, it should be little immediate. You should not give a very long time. So that is why we take cardiac death donation, it's called DCD, happens when somebody dies inside the hospital. It's easy to identify that they have suffered a cardiac arrest. If at all they want to donate, they can donate that point of time. I would like to tell that in India, it's still the Transplant Organ Act follows only donor after brain death. DCD, donation after cardiac death, the law is not yet passed. It's not clear. We don't do it routinely in our country. So there must be, all of you must be having doubts on the time frame on in which you should donate the organs, right? So some people say you can cornea, you can keep it up to many times. You can organs, I mean, how long you need. So this is the general list of the organs and the transplant timings. So the heart has to be kept in the cold storage and transplant within 4 to 6 hours. It's very time sensitive. Similarly, the lungs and the liver also within 12 hours, and pancreas. The kidneys, sometimes you can extend it up to even 2 days if you there's something called a machine perfusion. See, all these organs, when they are taken out from the patient, you have to do something called a cold storage for them to preserve their basal metabolic functions. So it's not like the organ is dead. So there is some basal metabolic function is happening, and to maintain that, we do something called a cold storage. So this much, if all of you understand, that's more than enough. So and the tissue transplants, so the corneas, the skin, the bone, and the heart valves, and so all this are the tissues which are obtained, and if you keep them in the cold storage, they can be used up to many years also. The corneas are harvested immediately after one's death. That is because within 6 hours, they come and take the cornea, because to maximize the benefit for an eyesight for somebody else. You can store them, and once they are taken off from our patient, they can be stored very nicely with no complications, because cornea does not receive any blood. It's an avascular organ. What is there? The outer covering of the eye. So that can be taken and kept in for at least 7 to 14 days, and that is the first thing what is usually harvested before the other organs, because it is easy to take it. Later on, it becomes very difficult for them to harvest the cornea. So suppose I or you or anybody in your family wants to donate an organ. So how do I become an organ donor? That will be a common topic of discussion for most of them. So the first step is awareness and decision making, of course. I hope after listening to this talk, I'm sure most of you would have been kindled to donate, to pledge their organs at least. So we should go to the online website. The Noto has a website. So we go there, and you can log in. There's a username, password, and then you can fill up your details. They'll ask your demographic details, and they will ask your family details, and it's very easy. The step is very self-explanatory. Once you pledge your organs, you get a donor card, which is issued. They even post it, or you can download it online. You always keep it with you. The most important step is you keep the family informed. So in case of death, see, in India, the graph says, the flowchart says brain death in the hospital. That's because the law in India has told the organ transplant team to retrieve organs only from donation after brain death. It's not like somebody died in the hospital because of an infection or a cardiac arrest. You cannot take their organs. It is very clear that still, and this is unfortunate, we need to expand our donor pool, but only brain death. So patient in the ICU diagnosed as potential donor, there's a brain death certification which is done by board of doctors 2 times 6 hours apart. And then the family is counseled. The consent is taken. The legal requirement is a consent has to be taken from the family. If the family doesn't agree, the organ donation will not happen. The organs assessed for suitability, so the next step is, even if they agree, all the organs may not be suitable for transplant. The retrieval team by the transplant surgery team will go there and decide if the organs are suitable to be transplanted. And then we have a transplant surgery. And then you have a system of allocation. That is quite important in our country. Being so many of us waiting, so many of these patients waiting in the line, the allocation should not go haywire. We have had patients coming and saying, "Doctor, can I get the kidney because I'm suffering?" According to India, everybody is suffering. Patient from 2016 to 24, whoever is registered, currently waiting, all of them are equal. There is no priority. In countries like US, you'll be interesting to know. Abroad, a second transplant receives a priority scoring point. In India, in most of the states, it's not like that. In Tamil Nadu, there is no priority scoring system. There is in Gujarat, there is in Telangana, but in Tamil Nadu, it's not there. So these are the places where the law is not uniform, These are the disparities of our transplant program, what is there. So in general, these are the steps in organ donation. So living donation is basically kidney and liver. Most of the rest all organs are from the deceased donors. The live kidney donation. So who can donate the kidney? This has to be decided by the nephrologist and not by anybody else. See, the donor undergoes stepwise test for fitness. There is a step 1 test, step 2 test, step 3. So this is very important. The donor's health is equally important to the patient's or the recipient's health. Everybody who comes for donation is not taken up for organ donor unless they are cleared by all these tests. Fitness meaning they'll go through a battery of tests: diabetes, hypertension, cholesterol, cancer screening, heart problems, everything. So the donor surgery is usually laparoscopic surgery performed nowadays. The open surgeries are very, very rare. Recovery is rapid because of laparoscopy in 4 to 5 days. And there is no long-term medical illness or side effects. Many times after kidney donation, patients will ask, "Doctor, what medicines do I need to take? Doctor, what diet should I follow? When should I come for checkup?" The simple answer is you don't need to do anything. You're not a patient. You're just a voluntary kidney donor to your family. All you need is a regular yearly master health checkup. So the kidney transplant, again, you should know that about the blood group. This will be a common doubt if you know any friends or family about kidney transplant. Usually we do a same blood group kidney transplant, usually. We all know that O is a universal donor. So the O blood group can give the kidney to any blood group. AB is the universal recipient. If somebody who has a chronic kidney disease and his AB blood group is very lucky, he can get the kidney from any other blood group. So similarly, the same blood group transplants are A to A, B to B. It can also be from O to A or O to B or different, as O is a universal donor, just as I said. There are, of late, to overcome the barriers of organ transplantation in kidney, the last 2 decades, they have seen considerable significant improvement in these 2 types of kidney transplant. One is, on the left-hand side, is the ABO incompatible. I stands for incompatible. ABO incompatible renal transplant. Suppose I have a mother who is blood group B positive, and the patient or the recipient is A blood group. So they both are not in the same blood group, nor mother is a universal donor, correct? So can the transplant be possible? Of course, the mother will be crying, saying, "I have nobody else in my family. Husband is a diabetic. Nobody else wants to give, my sisters, brothers, and all that." So all these problems will happen. So how do we do it? Can we do a transplant? Yes, of course. So this is called ABO incompatible renal transplant. So basically you have to do in this patient, somebody who is blood group B, who's giving to blood group A. You check something called anti-B titer in that patient. You basically remove that before transplant, and the success rate is almost same as the blood group transplant. Of course, the expense will be a little more. A mild complication of infection rate and rejection exists, but the overall benefit, that's what you should see in medicine. The risk-benefit ratio. The benefit ratio on waiting for a kidney and being on dialysis is very, very low. Rather than you can get a transplant, and you can have a mild infection, it's okay. You might as well get off dialysis. That's what we tell patients. And next situation is when there's a paired kidney exchange. Suppose, you have a mother to a daughter, mother is B to A, and you have another father to a son, which is A to B. So as mentioned in the diagram, they can exchange the kidneys. A can be given to A and B can be given to B. So this is called paired kidney exchange. Otherwise, we call it in layman's terms swap. You swap, SWAP, swap transplants. So we can have 1 pair, you can have 2 pair, 3 pair, 4 pair. Like that, you can go on increasing the organ donation pool for the kidney transplant patients. Now, I'm just touching upon the live liver donation, because this is also equally raising. It's as compared to kidney, living liver donor surgery is little complicated, requires surgical expertise. But the good part is the liver regenerates to more than 90% of the size after donation. We all should understand that we have 2 kidneys. If you take away 1 kidney, still the donor will have a normal renal function. You check the creatinine post-surgery, the creatinine will be 0.9 or 1 normal. 1 kidney is enough for everybody's survival. That is the God's gift. So you can always donate the other kidney. So that is the advantage of kidney. But liver, there's 1 liver. But again, liver has a potential. It's a beautiful organ with dual blood supplies, we say, and it regenerates to more than 90% of the size after the donation. The recovery time is, of course, it's a little complicated surgery, so it's 6 to 12 weeks of recovery time. Now let's get to something interesting in the last few slides. So I've just put forward some myths and facts. So let's go through the myths. Doctors won't save him or her. Organs will be removed. If somebody gives consent for organ donation, some of the other members in the family will keep, worry. So saving life is always first. Only if death is declared, organ donation talk will be done by the ICU and the organ retrieval team. So this is very, very important. So I can call any hospital and pledge my organ for donation. I'm in need for money. Can my kidney be removed and given to someone, say, Mr. somebody who's lying in that hospital? Is that possible? So the important fact is big no, no, no. Pledging has to be done online by online registration through Noto, or we have even these NGOs. There are a lot of NGOs. Most common example is the Mohan Diabetes Foundation. They have they also give the organ donation card. Once you register, that data is shared with the Noto, so it goes automatically. So we have a robust waiting list maintained by our state. Tamil Nadu state waiting list is there, and the national is also there. You cannot skip the line. No monetary benefits for donation. We have had many people coming to the OPD saying, I'm in need for money. Can my kidney be given for donation? The answer is no. Hospitals will not encourage that. I am 75 years old. I have diabetes and hypertension. Why should I pledge my organs? I'm already old. It won't be useful for anybody. This is a normal thought for anybody with all these diseases. My organ is already affected. Will it be useful? You'll be surprised that even these kind of patients, tissues and organs are retrieved. Tissues can be donated irrespective of the age if viable. Organs like liver, kidney can be donated to elderly patients who are waiting for transplant. And ultimately, the fitness of transplant has to be decided by the surgical team. My relative's body will be disfigured after organ retrieval. No, there will be no change. Body will be handed over with utmost respect to the family. There is no disfigurement. So the last rites and the cultural beliefs are maintained and it can be performed with dignity. My relative is not agreeing for organ donation, but I have pledged my organs. Unfortunately, you're in a very, it is a difficult state. Your organs will not be used unless your family agrees for organ donation after death. So after you have pledged your organs or before you pledge your organs, you should talk to your family. They are the ultimate decision-making persons. I've been diagnosed with chronic kidney disease. CKD is a new term for you all, I think, but for those you don't know, CKD is what we all deal with, chronic kidney disease. I'm not on dialysis. Can I register for an organ through the Tamil Nadu state? No, the law has made it very particular and stringent that you can register to receive an organ only after 2 months on dialysis. So if there is an organ donation alert in any hospital, the ICU team and the organ retrieval team identifies the donor. After the family has agreed, there is a communication through a separate app and WhatsApp groups. All the priority hospitals have to accept within a time. So generally there are 2 kidneys. A person has 2 kidneys. Suppose he's brain dead, there'll be 1 kidney will be retained by that local hospital in which the alert comes from. So, and the other kidney will be given to a common wait list. So that wait list depends on the date in which they have registered. Suppose I have a patient registered in 2018 in some hospital in Erode. He is the first person who will receive. And suppose in my hospital, I have a patient who's registered yesterday. He's the last person to receive. So that list is maintained very, very clearly. In kidney transplants, it's only the same blood group. I cannot say O is a universal donor. I cannot give O group kidney to B group. No, the Tamil Nadu Transplant Organization doesn't allow that. Kidney transplant happens only to Indian nationals. Liver, almost the same protocol is being followed. We have only 1 liver for one donor which can be extracted. Sometimes the split livers can be decided on a special request to the transplant. Blood group mismatch liver transplantations have been done. As I told you, suppose if there are no liver patients registered in AB group, I can exchange the blood group for liver under special permission. This is allowed. So these are the few rules which have been formulated by individual states to maximize organ donation. And Tamil Nadu is one such example. As I said, donation after cardiac death, law in India is not uniform. You cannot retrieve organs within the time frame. In hospital cardiac arrest, victims' organ can still be viable. The PGH Chandigarh and Delhi have done, but we need more infrastructure and more law to do that. So thank you. That's about the...
There are some questions in the chat box, Dr. Balaji. Should we read it
Yeah.
out? Some you have answered, I guess, but for the
I
benefit
will
of...
go through it, ma'am. Yeah.
Yeah, please.
Can other organs like liver, kidney be donated after cardiac death? If so, what is the time frame? See, the problem with the cardiac death is it is untimed most of the time. No, suddenly there's a cardiac arrest, and the patients usually die. See, the difference in brain death is the heart is still beating, so the blood supply to the organs is relatively preserved. So I would say for liver and kidney, after cardiac death, the hospital infrastructure should be robust to procure the organ as early as possible. And there is no time frame, earlier the better, because we don't want the organs to be without proper tissue perfusion. Perfusion means blood supply for a long time. We have to harvest it immediately, and then we have to preserve the organ function. So I would say as early as possible, provided your hospital this thing. How about the relevance of age of deceased donors? Whether an age donor organs can be suitable for age group or the same age group. See, as I said, sir, the aged organ donation, we do take elderly organ donation for our in our deceased donor transplants. We have had organs from 65 years, 70 years, 72 years. It will be quite surprising to see that after taking the transplant of these patients, the organs are functioning very good in those patients, in the recipients. See, it is not a rule that it has to be given to an elderly patient who's waiting on the list. Before, Tamil Nadu had these divisions. They had a separate list for elder and younger. Now it is not there. So a good kidney is what is needed. What is good kidney is basically decided by the organ retrieval team. It is a role of a nephrologist, hepatologist, transplant surgeon to convince a patient. See, suppose I have suppose a 60-year-old patient who's waiting on dialysis. He doesn't have any vascular access. Dialysis is not possible. All the veins have gone. He's very weak and fragile. He can get a kidney from 75-year-old, even if it's a hypertensive kidney, even if it's a diabetic kidney. If the creatinine is normal, we should encourage that patient to go for a transplant, because dialysis is making him weaker. Simple logic. You do a transplant, life can get better for him. Next question. A person has not registered for organ donation in the portal. Can his family decide to donate his organs after death? Yes, you can. Now, the organ pledging through Noto, Roto, Soto, and Mohan Foundation, all this is just to increase the awareness. See, most of the patients who still come to the ICU, who are brain dead, they are not aware of organ donation at all. So once the patient is declared brain death, hospital team goes and sits and talks to them, and then only they can give consent for organ donation. It is possible. If they've not registered before also, it can be a last minute decision. It is allowed. We have uterine transplant also in India, though numbers are small. Thank you. Okay, fine. Is there any app available where we may post our doubts? Okay. Yeah, we're always here to answer the doubts, but I don't know how many lives can one organ donor save. Yeah, as I said, one donor can save up to 8 lives. It can be lesser. Suppose if one patient requires both the lungs or both the kidneys, we don't know. It depends on the situation.
Any further questions from anyone here? Just such a beautiful session. So we should make use of the thing. Are there any successful awareness models from other countries that India can adapt?
Yeah, the awareness models have been very robust in the US, Australia, and Europe. Yes, India has partly already adapted to that. But what is the difference is it's only urbanized. It has not gone up to the grassroots level and it needs to be expanded. And maybe we should develop an own awareness model to expand into the rural areas. That's what we should concentrate on. Who is the major group of beneficiaries in your experience? You mean the patients, sir? Most of our patients who are on the waiting list are all the patients who have chronic kidney disease and chronic liver disease patients, and they're all in the age group somewhere between the middle third, somewhere in the mid age, 30 to 60 years are the beneficiaries.
So what is the success rate of a kidney transplant today?
Yeah. So given the modern era of medications, immunosuppression, the success rate of transplant is more than 96%. It used to be 90% a decade before. So it depends on what type of transplant. If it's a simple, straightforward blood group transplant, it's really it's really successful, around 90 to 95. Yeah, as I mentioned, if it's across the blood group, somewhere little lesser, 93 to 94.
Very, very interesting.
Yeah, I think Sir Padmanabhan, he wanted to know.
I am interested in donating. How to register? Any website available? Yes, sir. You could go to the NOTO website, National Organ and Tissue Transplant website, NOTO website itself, and then you can pledge your pledge. It's self-explanatory. There's a link which says how to donate your organs or how to pledge your organs. Or you can go to any Mohan Foundation outlet. So that is also possible. They'll give you a card immediately. What policy reforms could simplify organ allocation and reduce waiting times? I see. Okay, this is not controversial, but yes, we definitely need a lot of reforms in our policy. As I said, there's a lot of state disparity. One thing what I said is there is no priority points. We have patient who is transplanted who is again back on dialysis. We don't give there's no priority points for them in Tamil Nadu. Similarly, pediatric patients. So all these priority points could get centralized. So these are the few things what, all that can be done. Yes.
Any further questions? It's a rare opportunity to have a professor come doctor. It was so clear, like this one. That's what I was just thinking in my mind. Such a simple and very clear kind of thing. Even before we could pose the questions, and the answers were given by you. So that is the kind of speed and the clarity you had. Any further questions from anyone here?
Yeah, I have another question. This is Vivek here.
Yes.
Sir.
Okay. In a situation where, let's say, a brother donates one of his kidneys to an elder brother donates a kidney to younger brother, let us say.
Okay.
And what will be his post lifespan after the surgery in normal terms? Will there be any reduction in his lifespan of the donor, or he will live a normal life with one kidney?
Well, they will live a normal life with their kidneys. So there is no reduction in the lifespan. Long-term studies are there. There is no increased risk of blood pressure. There's no increased risk of death. There's no risk of kidney disease after donation. I have only one kidney. My kidney, the other kidney is strained in the body. Nothing like that. There's a lot of data to show that they are normal. The lifespan is not affected at all.
Because I know one person, one of my friends has donated his kidney to his brother.
Yeah.
And after the donation, he's now on the 38th year.
Yeah.
He's in the 38th year of his living after donation.
Okay.
So that's a live case. So.
Yeah. That's great.
And Dr. Balaji, you said the kidney transplantation success rate was around 96% or so.
Yeah.
Is it the same with the other transplant, liver, lung? Definitely it won't be, I know.
Yes.
What are the percentage of success, and is it because of any specific complication, or is it by the organ itself?
The
I mean,
organ itself, the liver transplant is surgically challenging. Medically, liver transplant is easy. Kidney is the most difficult medical transplant because the immunology, the medicines are complicated. Liver has a capacity to absorb all the antibodies, immunity. So the risk of rejection in the liver is less. So
Yes.
once a liver transplant is surgically performed well and the graft is accepted, graft means the organ is accepted, they generally do very well in their life. Success rate for liver transplant is definitely more than 90% in most of the centers now, unless they have other complicated issues, surgical issues, bleeding, infections with the account in the immediate post-operative period. The success rate for heart and lung transplants are still low in our country, and we need to work on them to have a better rates. And overall, the success rate of liver and heart the lung and heart is less. They're more immunogenic, they're more exposed to the surroundings. The rate of lung transplant, especially they're exposed to the organism. So infection rate is quite high.
And you also said in countries like Australia, USA, there is a mandatory kind of a thing. Do you think our country would achieve that kind of a
Yeah.
thing in, say, another 1 decade or
Yeah.
anytime, even that far?
Yeah, I think we should hope for that. I don't know, maybe we should, I mean, the cultural benefits, I don't know how far all the states uniformly will accept that. I think at the grassroots level, it has to start, and then maybe it could take more than a decade, ma'am.
I understand. I can understand. Yeah.
So one question you said about the skin donation.
Yeah.
So can you detail that is from where the skin is removed? You said there won't be any disfigurement to the person for the cultural aspect and the family
Correct.
relative. So
Yeah.
that is a very useful donation because a lot of burns victim.
Correct.
So,
Yeah.
from where exactly they harvest the skin from a dead person?
Yeah, normally the inner side of the thighs,
Mm.
that is where it is harvested, and the side of the chest wall. That is where it is usually done, ma'am. But yeah, generally, the skin transplants are already, the harvesting for the tissues is being done, but it's less common. I mean, the number of requirement is there, but somehow it is, fortunately, the burns are all partial. So they do an autograft itself from the patient themselves itself from other sides or take it from the other patients. So,
And if a person has a cardiac death,
yeah.
say it's a triple vessel block and a sudden heart attack. So how can that person can donate the heart for valves and other things, is it? No.
No, ma'am. You see,
Heart cannot.
yeah, that organ is diseased. So they will not usually be happy taking that organ.
Only a healthy heart can be donated.
Yes. Similarly, a liver, if there's a fatty liver which is detected on, suppose a patient brother has fatty liver, or the liver problems are there, they will not take that liver because it is fatty liver. It may not regenerate back.
Even grade 1 fatty liver?
No, they do a CT study. They do a CT scan and they do a detailed analysis. They do a fibroscan. They do to detect chronic liver disease. So there are parameters which are done and then they assess. An ultrasound will not definitely tell.
Okay.
They need to look at other parameters.
Thank you. Very nice. I am an organ donor. I have
thank you.
registered with Mohan long back.
Fine.
For,
Nice. Very nice.
10 years ago, I think I have registered. I have the card.
Done. Very nice.
So this is Ramakrishnan. I have a question. Kidney, is there any specifics regarding blood groups which can have a problem in getting a donor?
You mean those who are waitlisted on the government, sir?
That's anybody like that, saying that, like, is there any blood group which restricts the number of donors possible?
Nothing like that. See,
Oh.
I mean, the most commonest blood group everywhere, the O is the most commonest.
Yes.
So, and AB is the most rarest.
Okay.
So, and so the O wait list is very, very high. If you go to any hospital, if you see our Tamil Nadu O list is very high, followed by B, A, and then AB. So anybody who's registered in O positive, naturally their waiting time will be very high as compared to AB blood group. But the AB blood group, the number of organs which come itself will be less. You'll have rarely a AB positive brain dead donor who's coming.
Okay. So that means the blood group has to match. Am I correct?
Correct. See, that's what you have two scenarios, right? You suppose if you have a family member who's giving an organ, the blood group has to match. It can be a universal donor. O can give to any blood group, or the same blood group can be given.
Okay.
And if it's the government, if you're getting an organ from the government, the priority list that is called the disease donor program, as of now, it has to be in the same blood group. O can give only to O in that waiting list.
Okay. Thank you.
Doctor, this question is already asked in the site. Is there an age limit? Say, suppose I have somebody who is more than 95 years old. Is there an age limit for donating?
Definitely there's no age limit for organ donation, but depends on what organ they have to donate. So definitely the eyes can be taken. Definitely all the tissues, the bone, the ligament, the tissues, the donation will generally go on in these age group donors. How far the organ donation will happen at this age of 95 is a little matter of fact. For all you know, mostly 95 is an age where age related, the organs will start getting stiff. Their blood supply will be, they'll get more fibrosed. They'll start getting they'll start getting shrunk. So organs may not be suitable to donate at the age of 95 medically. So, but we still encourage the families to, accept for organ donation. So we don't know. We could have a patient who's 75 years waiting on dialysis, who really wants to have a transplant. For all you know, it may match. We don't know. It's individualized. It's personalized. But in general, 95 years, the success of taking all the organs for transplant will be less, but tissues can be harvested. Yes.
Sir, my husband is a kidney transplant anesthesiologist.
Okay.
So he was happy to hear surgeon, the nephrologist saying that, or they did the transplant, and then the person is living very happily now since 25 years.
Yeah.
It was done in Chennai in a private hospital in those days where there was not much advancement in other things. So the transplant surgeon was very happy. He called my husband. It was done under epidural. In those days, there was no laparoscopy and other things. So it was done under epidural. He was a transplant anesthesiologist. He's my husband, Dr. Srivatsan.
Okay.
Happy to share the good news.
Yeah, sure.
Doctor, which is the most difficult organ to transplant?
Small intestine. Small intestine transplants are highly difficult. Surgical expertise is very high and the highest chance of rejection. The small intestine has the lot of lymph. Lymph is where all our immune cells will come. Immune cells are the one like soldiers in the body. They'll start fighting against the organ. Small intestine has that within their anatomy itself. So small intestine is the most difficult organ to achieve a surgical success and a medical success.
Wonderful. If there are probably no other questions, I would, before I hand over to Dr. Senthil Kumar for giving a formal vote of thanks, Dr. Balaji, if you excuse me, I'm not able to resist myself in mentioning this to this audience. So I take your permission. To the people who are participating here, you can see the passion with which Dr. Balaji said. It is not just a doctor explaining. It is much beyond. And very recently, his grandmother who passed away, who's from basically probably from a very orthodox family, they have given her body with her consent. She, I believe, said her body should be donated, and they have done that. I think that itself shows the proof of the kind of passion and the awareness he wants to create. You can imagine, I don't know, her age should be 80 around?
87.
87, and she was very, I was given to understand, she was very particular and the family had done. So this is mainly to applaud the family, the kind of things one could do. Somebody was asking about the age, what we can donate. She has donated her whole body. We pray for her soul, and thanks a lot to the family. Yeah, over to you, Dr. Senthil.
Am I audible, ma'am?
Very much, yes.
Okay. Good evening, everyone. On behalf of Madras Chamber of Commerce and Industry and Healthcare Committee, It gives me great pleasure to deliver the vote of thanks for today's meaningful seminar on organ donation held as part of our healthcare initiative. First and foremost, I extend my heartfelt gratitude to our distinguished speaker, Dr. Balaji Krishnan, for sharing his valuable knowledge, experiences, and insights on such a vital subject. Your thought-provoking presentation have truly enlightened us on the importance of organ donation, dispelled myths, and inspired us to think of it as the gift of life. Maybe with one word, I think Padmanabhan sir has already registered in the NOTA site. Many congratulations, sir. A special word of thanks to our partners, doctors, healthcare professionals, and members of the medical fraternity who are constantly working at the forefront to save lives through organ transplantation. Their commitment and dedication are commendable. I would also like to thank the leadership team of MCCA for initiating and supporting this awareness program. By taking up organ donation as a theme, we have not only addressed a healthcare need, but also touched upon a social responsibility that has the power to transform many lives. And to all our participants who joined us on Room, who are enthusiastically asking so much of questions. And I should say that YouTube is also on live. Maybe they can go back and then rewind and then get back to the things. Thank you so much for all your active involvement, thoughtful questions, and encouragement. Your presence makes such initiatives truly impactful. Lastly, I must acknowledge the organizing team who worked behind the scenes to make this program seamless and very successful. As we conclude, let us carry forward the message that organ donation is not just a medical act, but a legacy of compassion. Together, we can create a healthier, more humane tomorrow. Thank you all once again, and we look forward for your continued support in our future initiatives. Thank you so much.
Thanks a lot. Just want to add one word because we have so many members. So if any of you are interested, please write to us. We can come to your place and address your whole team about this, Dr. Balaji and team from the healthcare committee. We would be happy to come to your doorsteps and explain to your workers there. Any members present here, feel free to write to us. Thank you.
Thank you, ma'am.
Thank you.